Welcome to Peds Doc Talk TV. I am Dr. Mona Amin, a board-certified pediatrician and mom, and in honor of National Prematurity Awareness Month, I am talking all about prematurity. How do we define prematurity? What are some risk factors for premature labor? What to do if you are in the NICU with a premature baby? How to care for your baby, including premature development, and also why I love WaterWipes for caring for your baby's premature skin. I made this episode in partnership with WaterWipes to celebrate National Prematurity Awareness Month, a month to recognize the hundreds of thousands of babies born premature every year and to promote education about prematurity. Before we continue, make sure you hit that subscribe button because that's how you stay up to date on all of my videos here on Peds Doc Talk TV. And here we go. We define prematurity as a baby who is born before 37 weeks. So a baby who is 36 weeks and 9 days old is considered premature. Prematurity can be further subclassified in different categories. Late preterm is 34 to 36 weeks. Moderately preterm is 32 to 34 weeks. Very preterm is 28 to 32 weeks, and extremely preterm is before 28 weeks. An estimated 15 million babies are born premature worldwide every year. According to ACOG, there are various risk factors that we should monitor that may put a parent at risk for preterm labor. It's important that you receive prenatal care and go to your OB visits to monitor for these risk factors. Remember, however, that having a preterm baby is many times not your fault and are issues out of your control. I find many parents feel guilty, and I hope you know that the best thing you can do is take care of yourself and go to your doctor's visits. Depending on the gestational age of your baby, you may need to be admitted to the hospital and may need to receive various medications to support the health of your preterm baby. Click the links in my caption for more information about preterm labor. Babies who are preterm will likely spend time in the NICU. The need for an admission to the ICU will depend on the gestational age and medical issues going on with your baby. It can be daunting when you don't expect a NICU stay and you are now in the NICU with a premature baby. I myself had a baby who was in the NICU for an issue that was not due to prematurity, and I know how stressful this can be. But I do believe that education and awareness can help when you find yourself in those situations. The NICU will monitor a variety of different issues. Depending on how preterm your baby is, will determine on how many of these issues will need to be monitored. Things like breathing, heart function, brain function, temperature instability, gastrointestinal feeding concerns, anemia, metabolic concerns, and infection concerns. The more premature your baby is, the more issues that may need to be monitored. The goal of the NICU and the NICU staff is to support your baby's health and development while they are growing and developing outside in the real world. Let's discuss the various organ systems that will be monitored in a premature baby and why babies who are born premature may have issues with these organ systems. The respiratory system. A premature baby may lack surfactant. Surfactant is a substance in the lungs that allows it to expand. Production usually begins after the 20th week of gestation and increases more steadily after the 32nd week. Because of this, your premature baby's breathing will be monitored to make sure that they are fully supported. In some cases, your premature baby may need surfactant, which will help their developing lungs. In the heart, there are different conditions that may happen. The most common thing that we see in premature babies is something called a PDA. A PDA is the most common heart condition monitored in premature babies. A PDA is a persistent opening in two vessels of the heart. Because a baby was born early, it didn't have time to close. Blood pressure may be monitored, and a baby may be administered medication to help this condition or close this if needed. In terms of brain development, babies who are born early may receive head ultrasounds to monitor any bleeding in the brain. Depending on the NICU and your baby's gestational age, they will do routine screenings of these ultrasounds to monitor baby's brain. Temperature instability. Premature babies have a harder time regulating their body heat. The NICU will assure that they are in an isolate or a warmer to assure that they are in a warm environment so they can continue to grow. In terms of the GI system or gastrointestinal system, babies in the NICU are closely monitored for nutrition. For ultra preemies or extreme premature babies, they sometimes need nutrition via an IV line and then transition to feeding by a tube and then by mouth. Belly size and belly sounds are also monitored to make sure the premature gut is developing well. In terms of feeding, many moms will ask, well, can I still breastfeed? Absolutely, this is a possibility, but initially you may need to pump. Depending on the age of your baby, pumping may be recommended because baby may be too young to go to the breast. If you're not producing milk, an option is donor breast milk. This is something that we do offer in many NICUs to give babies breast milk from registered donors. You are going to work closely with the lactation consultant team to balance breast milk production and nutrition for your baby. If you are formula feeding, the team will discuss the best formulas and the way to fortify the formula to make sure your baby is meeting their nutritional needs. Your baby in the NICU will likely need blood work done. This is to monitor for any infection concerns, metabolic concerns, which include sugar levels, potassium, various electrolytes, anemia, and jaundice. All of these things are done for the benefit of the baby. As a mom who had a baby in the NICU, I know how hard it is to watch nurses and doctors do so many different interventions, but these interventions are done for the best interest and outcomes for our babies. Another thing that you will see done in the NICU, especially if you have a very preterm baby, are vision screens. If a baby is born before 30 weeks or for certain birth weights, a pediatric ophthalmologist will do screenings of the eyes to make sure the blood vessels in the eyes are developing well. We are monitoring something called retinopathy of prematurity. Depending on the gestational age of your baby and what they are noticing on these screening tests will determine how often you will need this and if you will need to see an ophthalmologist after you leave the NICU. Throughout your baby's childhood, your pediatrician is going to monitor their growth and development. In terms of percentiles, your baby is not going to be on the normal term baby growth curve. They are going to have a special preterm growth curve. This is so that we're not comparing them against term babies. In the end, though, percentiles are not a comparison. They are trends, and including for your premature baby. We are looking how they are trending from the last visit. So rather than focusing on percentile, focus on where your baby was compared to the last visit. This is so much more important than the actual number. We want to make sure and monitor that they are growing on their own trajectory, regardless of their gestational age. A common question parents ask if their baby is born premature is, how do I calculate their adjusted age? Do I need to calculate their adjusted age? And what does that even mean? So we adjust the age of a premature baby because we can't always expect a baby who is born premature to do the same developmental milestones as a baby who is born term of that same age. So we look at adjusted age up until about 2 years old to accommodate and understand that there may be some differences in developmental milestones. So to figure this out, you have to know that 40 weeks is considered term in doing these calculations. I know I mentioned that preterm is anything before 37 weeks, but in terms of this calculation, we use 40 weeks as the benchmark. So a baby who is born at 32 weeks is considered to be born 8 weeks early. So they are 8 weeks before their expected due date, if you want to use 40 weeks as that example. So when your baby, who is a 32 weeker, is now 16 weeks chronological age, meaning they are 16 weeks old from their birth date, then we subtract 8 weeks from that to give you their adjusted age. So they are 8 weeks old in adjusted age, even though they are chronologically 16 weeks. So at 16 weeks, which is about 4 months, we would expect your baby to be doing the milestones of a 2-month-old. We allow that to happen. We understand that baby may not be doing everything a 4-month-old will do. But you will be surprised. Many premature babies, including ultra preemies or extreme preemies, may meet the milestones on a chronological age. So it really is done just to understand and reassure parents that, hey, we are monitoring this with the understanding that your baby was born early. In terms of introducing solids, many times you will hear, oh, you can introduce solids at 4 months and 6 months. You are going to be looking at developmental milestones. Developmental milestones are going to be how you determine when your baby is ready for solids. So whether you have a preterm or term baby, go by signs of readiness versus an actual age. Many parents who have a baby who's born premature are often worried about the developmental outcomes of their baby. Unfortunately, we don't have a crystal ball to determine what those outcomes will be. But what I can say as a pediatrician and someone who takes care of a lot of NICU babies is that NICU babies are some of the most resilient babies I know. They are warriors and they come out fighting and they are extremely resilient. Also, the baby brain is very plastic. It's always developing and outcomes can be good. I have had 24 weekers in my office who at 6 months of age are meeting the same milestones as their term counterparts. So I don't want you to go into this thinking that your baby is going to have poor developmental outcomes, because sometimes I think you can see that when you read things online. The best thing we can do is go to your doctor's visits, engage with baby from a developmental standpoint at home, provide a loving home, enriching experiences with you, and make sure to have some optimism. Optimism goes a long way in the health of our babies and the development of our babies, along with the love that we give them, to give them their best trajectory that is destined for them. Remember, our goal in terms of development and growth is to not compare our baby with another baby. We want to look at the individual in front of us and provide the best outcomes for them and not compare it to anybody else. Caring for your preterm baby in the NICU will be a team effort between you, the NICU nurses, as well as the doctor and medical staff. For many, this experience can be overwhelming. It can be hard to see your baby with all of the interventions that are needed to keep them healthy. I know this firsthand. Watching your baby attached to wires and monitors can be overwhelming when you expected perhaps a different experience. I want to reassure you that the nurses and staff in the ICU are there to help you. Ask the nurse who is with your baby how you can interact with your baby, how you can help with diaper change, when are you able to hold your baby, do kangaroo care, and do various things to connect with your baby. They will make sure that you are involved with your child as much as possible. You can be part of your baby's care as soon as you are ready. But remember that the medical staff will guide you on what you are able to do. I know as a mother and a father, this can seem very unnerving and very stressful when all you want to do is hold your newborn baby. But remember that this is done for the best interest of your child, to make sure that they are receiving the medical interventions that are needed, and also balancing your touch, your comfort, and your interaction to promote their development. One thing I really love to do is read to your baby. This is something I did as well. Reading has been shown to help babies' development, including premature babies. So when you are able to, if you're not able to hold them because they have medical interventions that don't allow you to do that, talk to them. Read to them, let them hear your voice, and talk to your nurses on other ways that you can get involved in their care. For any healthcare professionals watching, as a pediatrician and a mom who had a baby in the NICU, I encourage, if you are a newbie to the NICU, that you talk to your more experienced nurses or doctors on how we can balance development as well as interaction with baby's medical care. This balance is important so that the parents feel involved and yet the baby can receive all the medical interventions needed to help them grow and develop. See my link in my show notes for more information about a NICU stay and how to interact with your baby in the NICU. Part of baby care is newborn skincare. Many babies have sensitive skin, including premature babies. You initially may need a premature diaper, and as they get older, you'll be able to size up. As a pediatrician, I love recommending WaterWipes because it is the #1 clinically proven wipe brand to help reduce the incidence of diaper rashes, including in premature babies. In one study, the University of Utah study, it showed that using WaterWipes in conjunction with other skincare measures reduced the incidence of diaper dermatitis or diaper rashes by 17% in premature babies. The study looked at over 1,000 premature babies and revealed that consistent use of WaterWipes alongside other perineal skincare guidelines reduced diaper dermatitis incidence in premature babies by 17% and severe diaper dermatitis by over a third. The duration of severe diaper dermatitis was also reduced by more than half. WaterWipes are in many NICUs across the country, and it is one of my favorite brands, both as a pediatrician and a mom of a NICU baby. Although my baby was not in the NICU for being preterm and was a term baby in the ICU, I am so excited to partner with WaterWipes as they share their mission to help protect the skin of our tiniest patients. Thank you for tuning in. If you have any questions about WaterWipes, about prematurity, about things that you would want to add in terms of content to prematurity education, comment below and see you next time.